Welcome to a presentation on how to position a patient in bed. This is a demonstration by Providence Hospice. Jackie and Jessica will be demonstrating today. A few key points to remember is how important positioning is of the bedbound patient. The goal of positioning is to prevent pressure and to move the patient if they're unable to move themselves. Pressure areas can develop in a very short amount of time. So the goal is to be able to make the patient comfortable even if they're uncomfortable for a short time as we move them. You're going to want to have a couple of pillows, 3 to 6 pillows ideally. If you don't have that many pillows, extra blankets or sheets can be used to roll. The first position we're going to show you is how to position the person on the side. It can be either side. The demonstration works the same way, keeping in mind that ideally, if you can reposition the patient even slightly, at least every 2 to 3 hours, you're going to have the best condition of the skin possible. It's not always possible to prevent pressure, but repositioning is the best way in the home to do this. As you can see, Jackie's using the draw sheet to pull the patient towards her, not grabbing onto the skin. You're using a pillow to fit snugly underneath the patient between her buttocks and the shoulders. This relieves pressure on the backside and the coccyx, which is a very common area of pressure. The next pillow will be used to support the hips by placing a pillow in between the knees. It also prevents the skin from touching on both knees. Pressure also occurs not only from bed to skin contact, but from skin to skin contact. A third pillow is used to prevent the contact on the bed. The other areas of pressure you want to make sure that you're monitoring are the elbows and the ears. So when you do these repositions, make sure that you're putting the elbows either on a different pillow, having the patient wrap their arms on their chest, and turning the head from side to side. Sometimes a favorite blanket or a stuffed animal or a small pillow can be used to provide comfort. Next, we're going to demonstrate how to relieve pressure when the patient is positioned on their back. Again, if you can reposition every 2 to 3 hours, you're going to rotate positions from the right side to the left side to the back and rotate them throughout the day and night. If you notice the patient is groaning or exhibiting signs of pain, try to administer pain medication or comfort medication prior to turning. It is okay if the patient is slightly uncomfortable during a turn. We want to make sure that we can get them to relieve the pressure as well as to prevent any pain from being in one position too long. The pillows are placed under the draw sheet so that you can still use the draw sheet to reposition the patient. The pillows are again snugly against the patient to prevent rolling. And this position props the hips up, relieving pressure on the coccyx, and also helps to reposition the shoulders. Another pillow is used to place under the heels. If the feet or legs are touching, either use another pillow or a rolled up towel to keep the legs separated. This position is a comfortable position for a couple of hours, but make sure that you're also checking in between that time to make sure that the pillows haven't shifted. So it's not always necessary to remove all of the pillows with every position change. Either if the patient doesn't tolerate it or if you're just trying to make a slight adjustment, removal of 1 or 2 pillows is still considered a position change and will help to relieve pressure. Another key point in repositioning is to make sure that after the position change has been made, that the person is not laying directly on their shoulder. This is another pressure point, and it's also just uncomfortable to lay directly on a shoulder. So something as small as a little pillow underneath can reposition the shoulder off of the bed. This is also a good time to, again, make sure that the head has been repositioned so that there's not enough pressure on individual sides of the ears. If you have any questions about what you've just seen in this demonstration, please don't hesitate to contact your hospice care team.